Hi guys, today I'll be talking about retinoic acid as well as retinol and other retinoids. What is retinoic acid? Retinoic acid is the most bioactive form of vitamin A which can be used to treat various skin conditions. Consistently using products with retinoic acid improves photoaging such as skin damage from sun exposure as well as skin aging. Initially, retinoic acid was aimed to treat acne, so dermatologists tested the effects of retinoic acid on adult women with acne and saw reduced follicular keratinization in comedonal acne as well as a smoother skin appearance. Retinoic acid has also been demonstrated to reduce various signs of skin aging by producing new collagen as well as repairing previous damage by inhibiting collagen degradation through blocking collagenase activity. Epidermal thickness is also improved with frequent use of retinoic acid, which improves the appearance of fine lines. Retinoic acid attaches to specific retinoic acid receptors and retinoic X receptors, which can control the growth and differentiation of normal skin. The receptor activates gene transcription when they attach to the regulatory areas of DNA. In this diagram, you can see that retinol, retinaldehyde, and retinolate are vitamin A derivatives. Each derivative has to be converted by the skin into retinoic acid, which is the most potent form of vitamin A. And by doing this, it can be recognized and utilized by cells in the body. Benefits. Some of the benefits of retinoic acid include reduction in signs of photoaging, improvements in chronological skin aging, increased cell division in the epidermis, as well as restoring injured and unorganized cells with new organized cells, decrease in melanin production, which can help minimize hyperpigmentation in the skin, the development of new collagen and elastic fibers in the dermis, smoother and thicker skin, reduction in the fine lines and wrinkles in the skin, lightening of dark facial blemishes such as age spots or liver spots, improved blood flow and oxygen within the skin, resulting in a more bright and rosy complexion. Consistent use of retinoic acid may reduce the development of precancerous lesions, including solar keratosis. However, this is not the desired treatment for this lesion. These improvements are usually observed after a few months as the effects are mostly gradual. The greatest improvements happen in the first year of using retinoic acid regularly. Severe UV damage can only be improved to some degree. This is the same for deep wrinkles and expression lines. Changes are mainly seen in fine lines and wrinkles. Who may benefit from retinoic acid? Retinoic acid is beneficial for those aged 35 years or older with signs of photoaging from prolonged exposure to UV. Some of these concerns are an increased number of wrinkles and dark spots. Skin damage that occurs during normal aging or chronological aging is also improved with the use of retinoic acid. Guidelines for use. Retinoic acid cannot be sold without a doctor's prescription. There are various types of retinoic acid that individuals can use based on their skin type, age, degree of sun exposure, and sensitivities to certain medications. There are 3 different concentrations, including 0.025%, 0.05%, and 0.1%. The lowest concentration should be used initially until the skin builds up the tolerance, and then the concentration can be increased gradually. The product is usually applied as a cream, however, gel formulation can be used for very oily skin types. Prior to use, the face should be washed with a gentle cleanser. It is applied at night and washed off in the morning and shouldn't be used during the day as it increases your skin's sensitivity to the sun. Retinoic acid can be applied to the face, upper chest, arms and backs of the hands, and only a small amount should be applied to the skin. pea-sized amount is recommended to be used for the forehead area. At first, retinoic acid should be used every second night until a tolerance is built. Then it can be used every night. After about a year, when the skin condition has improved, application can be reduced to 2 or 3 times weekly. Sun exposure and smoking should be avoided while using retinoic acid, and some protective behaviours including sunscreen and moisturisers should be incorporated. Moisturiser assists in preventing skin dryness that can occur from frequent retinoic acid application. Side effects. Following the first application of retinoic acid, the thickness of the superficial epidermal layer and keratinous layer is reduced. Consistent use over a long period impacts cell division in the epidermis and leads to thickening of the epidermis. Initial use will cause the skin to become dry and some scaling to occur in the first 2 weeks to 3 months before clearing up. Cream-based products are recommended over gels, as gels can dry the skin out further. However, gel-based is a good alternative for very oily skin. Moisturiser can be applied during the day in combination with retinoic acid at night. Other side effects include skin redness and slight stinging sensation over 2 weeks after use. These effects usually don't persist longer than 2 to 3 months. However, if they do, you should see a doctor. Some things you should consider are stopping treatment momentarily, choosing a lower concentration of active ingredients, applying less cream or gel, and applying the product every 2nd or 3rd day. Retinol and other retinoids. Non-prescription vitamin A derivatives include retinol, retinaldehyde, retinol palmitate, and retinol esters. Retinol is a 20-carbon molecule that comprises of a cyclohexylene ring, 4 double bonds connected to its side, and an alcohol end group. Therefore, it is also known as an all-trans retinol. Aldehyde, which can be an all-trans retinaldehyde or a retinol, is produced from oxidizing the alcohol end group in retinol and can be used to improve wrinkles and skin texture. This is then oxidized to a carboxylic acid. The body cannot synthesize vitamin A, and therefore must be delivered to the body. It can be found in different sources such as retinol esters and beta-carotene. Retinol and retinol palmitate are frequently used non-prescription forms. However, each form needs to be changed to the all-trans retinoic acid form to be able to attach to ligands and produce beneficial effects. Penetration into the skin is enhanced with retinol compared to retinol palmitate, retinaldehyde, and retinoic acid, which have lower penetration abilities. Through measuring for hydrolase activity, this determines the penetrative abilities and is also linked with the amount of all-trans retinoic acid in the skin. The pure form of vitamin A, which is retinol, is mostly found in the skin. Care needs to be taken storing retinol as it is sensitive to air and light and can oxidize very quickly if exposed to poor conditions. Retinol is a precursor to retinoic acid. Following use, it penetrates the skin and oxidizes and is converted into retinoic acid. Retinol produces similar effects to retinoic acid, but with less skin irritation. The beneficial effects of retinol or retinaldehyde on the skin may be similar, but weaker to retinoic acid according to several dermatologists. Various factors including the active ingredient, the preparation, concentration, and if there are compounds in the preparation can affect treatment outcomes. Skin texture, dyspigmentation, dryness, and fine lines are improved with regular use of retinol with concentrations between 0.0015% and 0.3%. Retinol and other retinoid-containing products can be bought without a prescription and can be purchased from many retail stores, making it very easy to purchase and becoming an increasingly popular product. There are different preparations based on different moisture levels, texture, feel of the product, and inclusion of other ingredients.